Alana Sigmund. I am the Medical Director of the Arthroplasty Service at the Hospital for Special Surgery. The paper I've published, along with co-authors, is Postoperative Tachycardia, Clinically Significant or Benign Consequence of Orthopedic Surgery, which will appear in Mayo Clinic Proceedings. The first finding that's important is that among 1,755 patients in a development data set, a heart rate of greater than 110 beats per minute was found to be the best cutoff for a vascular outcome. The second finding that's important is that among 4,621 patients in a validation data set, a heart rate of greater than 110 beats per minute was associated with an odds ratio of greater than 9 for pulmonary embolism. The takeaway message of this paper is that postoperative tachycardia should not be dismissed as a normal clinical finding, but rather a finding that can precede adverse outcomes. This finding relates to clinical practice in two ways. If a provider is considering working up a patient for a pulmonary embolism or myocardial necrosis, and they find that the patient has a heart rate of greater than 110 in the first 4 days after the surgery, they should pursue the workup. Given the negative predictive value of this finding, the absence of a heart rate greater than 110 may be reassuring. But if the provider already suspects pulmonary embolism or myocardial necrosis, they should probably pursue the workup. For patients, this means that in the first 4 days after surgery, if they have a heart rate that's greater than 110, they should expect a discussion with their provider about whether a further workup is necessary or not. This paper is limited by the fact that it's a retrospective study. A prospective study using physical findings to determine what further workup is needed is the next best step in research.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.